The Federal Executive Council approves 4.8 billion naira funding package to sustain HIV treatment programs across the country. And it's been quite a while I see stories like this. I believe this is not unconnected to the WHO and what is currently befalling the international organization, where the United States of America is pulling out or has pulled out completely from sponsoring these packages that has to do with health and treatment, using the instrument of USAID to give out tokens to countries who are depending on the United States for this purpose. Could this be the reason why the government is launching a 4.8 billion naira funding to sustain the HIV treatment programs across the country? And how are other African countries responding to this? But first of all, let's consider what's happening home. Doctor?
Well, I don't know when last I heard about this HIV. I thought it's
gone. It's dead and gone.
But I think we should spend more in terms of preventing, educating people. Yeah, because the cost of prevention is quite cheaper than the cost of treatment. Somehow, we see that I put some certain money in place for people's, will I say now, their mistakes. You know, somebody did a study in the 19th century of two families in America. One was an atheist family, and the other one was a family of somebody who was morally upright. And then they came up and said, one family who had no value cost their country so much. And I think this is where we need to really emphasize that people had to be chaste, people had to be I don't know how we are going to do this canvassing so that we are not costing government so much more. That's so huge money, 4.something billion, can tie some roads in the local government that we are going to chase on people's bad behavior. That's the way I see it. And
when you say bad behavior, what do you mean?
How do people get HIV?
There are different ways.
Oh, there are different ways. And sometimes it's not transferred sexually.
That's what we were told.
Is that what we're told, or what is the reality?
That's part of the reality that people don't.
I doubt if it's a reality. And I think these are also issues we also need to also look at frontally. I remember those days when Abalaka was trying to also make some news in that area.
Yes.
And of course,
maybe the local man who discovered some form of cure.
Yes, we shot them.
Who said he had discovered some cure?
Because these are some of the conversations that we must be looking at. And I think this is also before the American Congress as we speak. Because J.F. Kennedy Jr. says that America is spending money on big farmers that they really don't help the health of the people. That where people should be taught how to eat and eat rightly, the government is funding the big farmer, which of course is one of the executive order that Donald Trump is signing right now. So where government will continue to support big farmers or to teach people how to do things right. And I think that for me is the cheapest way to go, rather than really, I don't think people are sleeping on their bed and then HIV will come. And there are a few things that say, okay, maybe you are sharing equipment for your hair and things like that. Little investment in that can solve that kind of problem. And I think that is what we should advocate so that people can actually save government rather than by bad behavior creating
this bad behavior you kept on mentioning.
Yes,
I hope we're not going to discuss it on Friday because you get blessed and laughing profusely about that statement.
It's the way he says bad behavior. It sounds like, your father, you come to your father and you say you have a problem. So it sounds exactly what a father would say, what an elder would say, this young generation, bad behavior. But we do know that HIV and AIDS is a disease that has been with man for a very long time now, and there have been several scientific research towards finding a cure for it. Doctor mentioned a natural medicine practitioner who came up at one time to say, Dr. Balaka, to say that he had found a cure for AIDS. We didn't really handle that the way we should have handled that. And several others who have come up to say they found a cure for HIV and AIDS. Because why are we spending so much for HIV treatment? It's because the cure has not been found. If the cure to a disease exists, then the treatment you're giving to people means they get better and the disease is cured, you're free from it. But it is just to manage the disease, manage the conditions that come with HIV and AIDS. Currently, it is reported that about 1.8 million Nigerians are living with HIV and AIDS, and that the allocation that the health sector gets out of Nigeria's budget is about 4%. So this amount of money that has been released specifically for the treatment, providing treatment for HIV and AIDS, is coming because of U.S. suspending funds for USAID programs, that's US AIDS program, which Nigeria has benefited a lot from, which the HIV and AIDS patients have gotten a lot of support from. So it is now obvious that there's a vacuum, you know, and there's hope, however, that after the review period is over, perhaps these funds will keep coming. But in the meantime, Nigeria is looking for ways it can bridge that gap, or at least try to bridge the gap, because it's a lot. And you know that this medication, they need to constantly be on them, else their health will suffer. And that means that other persons who interact with them unknowingly might also be at risk. When I say interact with them unknowingly, interact with them in a way that could expose them to being infected. That does not mean that you should stigmatize them and not have physical interaction. Yes, you can have physical interaction. Medical practitioners have told us that with people who are infected with the HIV and AIDS virus, but there are certain interactions that you cannot have and should not have them, and that's when it means that you're exposed to body fluids from them, so you should avoid that. Coming to the doctor's advice and thought on it as bad behavior. Yes, to an extent, I would say that is correct, but not totally correct. Because when it comes to HIV and HIV infection, some people were infected unknowingly. There are rape cases where through people have been infected. There are cases where women were in their homes, husbands were in their homes, and their partner, who was badly behaved, brought the disease to them. But because their partners in the confines of marriage, so the issue of asking for protection or having protective intimacy did not arise. So they became infected because of the indiscretions of their partner. There is that part. And there are still people who till date argue the existence of HIV and AIDS. Some persons tell you it's just some conspiracy theory, is what the West tells us. It is not real. So there is denial, which brings us to the point of awareness. We need to revive those awareness campaigns again. We're battling as a country to take care of those who have already been infected. We cannot have infections or the rate of infections rise. There are testing centers here and there, but how many persons have the boldness, let me use the word, the lever, to walk into a testing center to say they want to know the status?
Positive, they keep you
when
there.
last did you inquire to know your status? Because this is something that has to be done periodically. Now, for the other reasons or other ways through which HIV and AIDS can be gotten, sometimes we also have become nonchalant in protecting ourselves. As a lady, you go to the salon and you want to have your hair done or you want to have manicure, pedicure done. Do we still insist on having certain protocols, certain precautions as we used to in time past, to say, oh, if you want to have a weave-on sewn on you, you go with your own needle so that you don't have stories that touches later. You want to have manicure and pedicure done, you ensure that they are sterilized. So we must again begin to enforce those precautionary practices that helps limit the rates of infections, because now not much is coming to take care of those who are affected. And if there are ways we can also have these local donations towards these causes, then we can begin to look at it. And another thing, our eyes must be open now better to scrutinize funds that are committed to this cause to ensure that they are judiciously used.
Thank you very much. Now, for me, I don't want to even speak about HIV/AIDS, or I want to just speak about the participation of the United States in sponsoring the WHO and how it has, through the United States Agency for International Development, sponsored some of this in the treatment of HIV/AIDS or the coronavirus or Ebola or any other disease that must have been taking place either in Nigeria or any part of the world. And since the pronouncement of Mr. Bush and the establishment of the DOGE, which is the Department of Government Efficiency that is being headed by Elon Musk, the very good friend of President Donald Trump, there are lots of stories coming from that angle. There are reports that most agencies that is working directly, or civil society organizations that are getting some form of funds to assist people either in buying drugs or help people with medical condition that is coming from USAID or the WHO at the moment now has ceased. And some of them have been told to go back home because no funding at the moment is coming. In fact, I still know that when we start looking at this issue in-depthly, we know Donald Trump administration and of course his good friend Elon Musk going to face some court challenges, court, not just allegations, but they will have to appear before Parliament because Parliament actually plays a lot of statutory roles to making sure that this money is going out of the records that will be looked at. You will need to have some parliamentary oversight functions before you can go ahead to do that. So now that there was a document that surfaced about a week or 2 weeks ago about that said that Nigeria is going to lose $1 billion from now that Donald Trump has cut up support from Nigeria and every other country that will be benefiting from this. That Nigeria is going to lose $1 billion in support from the health sector coming from the WHO and the USAID. And what the toll that's going to have in our economy, in the medical sector in Nigeria, in the medical industry, and the people that will suffer for it. Because I remember vividly there was a time I know someone who went to the hospital and he was diagnosed with one of these diseases during the COVID-19 epidemic era. And he was tested for COVID-19. It was not COVID-19. I'm trying to recall back the name of the disease. It has to do with breathing.
Is it anthrax?
No, it's not even anthrax. Its name just escaped my mind.
We can see that.
Trust me, he couldn't buy the drugs. He was given drugs for 6 months to treat himself. And these drugs are not the kind of drug he could afford. An NGO was responsible for that. They gave him that drug for 6 months. Immediately he's done using that drug, he needs to come to the hospital with the empty sachet of that drug. After a month, he must have finished that dose. Then he will be reissued another one. If you do not come with it or you miss a day, you will be penalized. And he stuck to it. And this didn't come from the Nigerian government, through an NGO who has a support from USAID or the WHO. Now that this is happening under Donald Trump, what are the implications and the consequences we're looking at as a country?
I don't see so much of consequences having to actually go to the route of Donald Trump. Somebody published yesterday that even on the American embassy say how we are described, especially our health system, how it's described. But there's a side to the issue of this international funding. And I have always all my life been suspicious of some of all these things that we talk about. That most of the drugs that are produced by big farmers are never designed for curative purpose. They are designed for management purposes.
That's a strong allegation, you know.
And there's known, it's not allegation, it's known. If you have anybody who has high blood pressure and they give you medication, what do they tell you? You have to take it all your life. Taking it all of your life means that you have to keep that big business, a big company in business. So the intention is not to cure, the intention is to manage. And then, of course, you keep the company in business. And this is why I have always been suspicious of WHO. Why are we so much interested in managing and not exerting energy in looking for cures which can even be found local? I grew up in a village and I can see a lot of people who have different kind of ailments and they come around and treatments are administered and these things, they go and not come back. Why are we not exploring cure? That we are only interested in managing the disease, even including the so-called antiretroviral, is to manage to keep people alive. And the producer is completely in trade as long as the person who is carrying that virus, so-called, is still alive to buy it. So we must also look at the economy side of all these things as if it's just something that if it was a philanthropy. And I think it's beyond philanthropy. And people are also thinking about the side effects of some of these drugs. Of course, you see that are not produced locally, they are all imported, so that all this aid, actually, that the money that's supposed to be meant for you is actually to create market somehow for those big pharma. And I think that is what is on the front burner in the US Congress as we speak. You know, I listened to a little clip this morning where somebody was saying that, oh, it's good now that the Democrat has come out to say that they were using USAID to fund freedom fighters all across the world. That stopping USAID will make sure that all the money that's going to freedom fighter across the world will no longer be going. And this is to tell you that how these people have been using government money to fund insurrections in countries beyond what we are looking at, that the intention is actually not for the welfare of these people, but there's an ulterior motive in some of all this aid that is coming. And I think what Donald Trump is doing is not canceling, is having a 90-day window to really examine what is happening in all of all these agencies, to see that America is not just pushing money out to the third world for purposes that is not as it is imagined. This, for me, I think is a wise decision for any leader to take, and that is quite very, very important. And I think that we need a lot of collaborations between our institutions of learning and the local people around us who also say they have some curative capabilities, so that some of all these things can actually be studied scientifically, and then we see how we can commercialize some of all these things for the health and the well-being of our people. I know in the city of Lagos here, even how people that you think that seems to have been enlightened haven't taken enough of anti-malaria, anti-typhoid medications, resort back to their book that people are carrying in their head. And some people even find it as more effective than the so-called one that are bought in the pharmacies. These are things that we must put our energy to study. Are they really effective? And if they are effective, how do we promote it? That we are no longer we are not just using it for ourselves here. We are also able to ship it abroad to cure some of these ailments for the people in the West who are also victims of these big farmers.
Okay.
Well, I think that sometimes certain things need to happen. There are certain situations in life that happen that act as a push. If having been blessed by natural resources, including plants, we have the herbs, and we neglect them. I'm not saying that using orthodox medicine is bad. No. Kudos to scientists who have developed orthodox medicine. It has brought healing to a lot of people. It has cured a lot of sicknesses and illnesses and diseases. At the same time, there are some that have defied science, and one of them is HIV and AIDS. So, and that's a big problem. There are others like cancer, which scientists are still making research on. But we have natural medicine that can be harnessed. When I was speaking earlier, I said the Dr. Abalaka's issue wasn't well handled. And we've seen several other issues not well handled. During the COVID-19 pandemic, there were medical practitioners who were able to use herbs because they know what those herbs contain to treat COVID-19. Some of them had it, they treated themselves and they became well. Some of them treated other persons. There were local traditional medicine practitioners who also made health remedies, and it worked for people. After that time, did the Ministry of Health go back to say, let's look for a way to harmonize this. Let's look for a way to create our own standard for this and standardize them. Let's do research into these plants, into these herbs that we used, and find out what kind of medicine can we get from this, so that we too can also make money from it and also will treat people. You know, we neglect this thing. So now that much fund is not coming, even though there's a waiver for the HIV and AIDS support from the US, even while the suspension is ongoing. As you said, yes, there's a waiver for it. So that part seems to be covered. It is now that we're afraid that less fund will be coming, we're jittery. What do we do? What do we do? The US alone spent $40 billion on USAID, out of the $68 billion that is budgeted for it yearly. That's a lot of money coming from one country. And Trump thinks that there's tremendous fraud going on in that agency. Himself and Elon Musk think the same about it. And that's why there's going to be an audit of the agency, a review of some of the programs that they do. Now, when they are done, if they find that there is fraud, I know persons who are culpable will be made to face the law. And then some other programs will be reviewed. What that means is that we may have we may have less funds coming from the US after all. But we as a people, what are we doing? What is our plan towards ensuring that Nigerian citizens are well taken care of in health and in other areas? What areas were these programs covering, or what help were they offering to Nigeria? How is the government and ministries that are responsible for these areas thinking of strategically coming up to provide cure, to provide support for these areas? Because Christmas does not last every day. It's only on Christmas Day that you see that even your neighbor brings food to you without you asking. But it's just for one day. After that day, you have to feed yourself. So let's assume that Christmas lasted for a lot of years, since 1961 when USAID was founded. It has lasted. Now Christmas is almost over. What are we going to do? So we must begin to look internally. How do we help the health sector? We have a Ministry for Natural Medicine. What funding is going into that ministry to ensure that that ministry is well able to conduct research to empower natural medicine, to ensure that people can take care of themselves, or we can provide help? Because trust me, if the treatment for certain illnesses and diseases that Africa is battling with, from malaria to HIV and AIDS, if the cure is here, it will be easy for people to access it because it will be cheaper. You're not buying them abroad. It will be cheaper here for people to access. And for the agencies, yes, some NGOs are doing very well, but are we asking questions to say, if there's an agency that helps humanitarian affairs, are we sure that where money has been provided to send 1,000 people to school, 1,000 people actually sent to school? Where money has been given to feed 500 persons, 500 persons are actually fed? These are things that we need to do to ensure that funds are not being given to people for certain purposes and they are not well utilized. Okay. And as a people, we must be responsible for ourselves first, and even begin to forget whether funds will come from the US. If it comes, fine. But if it doesn't come, what is the plan on ground to ensure? Because the welfare and the well-being of Nigerians lies first with Nigerian government and not with the US.
Great.
Yeah, but without getting off track.
That's where I want to take us back to.
We want to come back to HIV/AIDS in Africa.
Doc, just a moment. So sorry. I want to bring you back there. However, I think the name you said sounds ambiguous. So it is not just tailored towards health. I know of NGOs who are getting money from this organization, and women that are undergoing domestic violence at home are getting support from these NGOs. Children who are not in school are getting support from these NGOs.
I don't want us to go
about
to
40,000, about 40,000 people in Syria have been put out of job because of the restriction that Mr. Donald Trump has just imposed. Even in Nigeria and in the northern part of the country, there are NGOs and organizations who are shutting down for this purpose. Even though Mr. President is saying 4.8 billion naira is for AIDS and to sustain its treatment for the people who are undergoing those specific diseases, is the Ministry of Health playing that specific role? So, Doc.
I think this is a budgetary provision for Nigeria, and I don't think this is based on what USAID is going to supply to us. And I think we must also clear that from it, because what is happening is that the Ministry of Health is allocating that sum to say we want to use it to fight HIV and AIDS, which of course is prevalent in our environment. And I will stay where I am. Prevention, they say, is better than cure. And I think we should spend more money on increasing righteousness. And I think that is, for me, where the issue and the core is in this conversation. We cannot continue to use money that can be used to better the life of every other person and channel it to, like I said, because most of the cases that we're talking about is that some of all these things are no cases. I was listening to somebody who was talking on a podcast recently, and he said, oh, how he was using 700 naira to 1,000 to sleep with over 1,000 women in Obalindi, and only to realize that he has acquired HIV. That's avoidable. That's not necessary. And I think these are where government must put emphasis. We must put emphasis so that people are not using their bad behavior, I repeat, to create problems for government. We're seeing that in the abuse of drugs and the rest of it. While we are looking at what is coming from the outside to deal with the issue, I don't like looking at symptoms. I like dealing with root causes, that what is actually responsible for this, so that the children that are coming out and watching us this morning understand that HIV, people acquire it, and it comes through immoral behavior mostly. Because these other sources that we're talking about, they are not as pronounced as the immoral side of it. And that huge immorality had to stop. And government must spend money to educate people to avoid it. And there is something somebody said some years ago which really made some sense to me, which is, of course, you still see Planned Parenthood Federation, which also donating money to spread condom around for people, rather than emphasizing abstinence. And we are pushing people. And today we also realize that condom is not saving anybody. It cannot prevent HIV from people having it. And there are a whole lot of accidents and leakages that have been proven in that direction. And I think what is important is that we have to preach abstinence. Let people get off that track and focus their life on what matters the most, and that is the future that is before them. And then, of course, don't become promiscuous, and then you go to acquire things. And I think even in the area where people are going to marry, you also have to be sure that the person that you are married is clean enough, that have not acquired something elsewhere, and now is going to transfer to you, who is free. And these are issues and measures that can be put in place. It is possible that even for Ministry of Interior, which give marriage certificate to people, to begin to demand from people who want to marry such certification to see that they are clean of HIV before they come together. All these leadership measures can actually help to reduce this kind of budgetary allocation to things that are avoidable.
All right.
Yeah, I think that's good for them to ask that. There are some organizations, before you even get a job there, they ask for your medical records, and they ask that you go for certain medical tests before you are employed. That is not to say where a person has been unfortunate enough to have contracted the disease that they should be discriminated against. But what I was saying here is this. People should begin to see it as personal responsibility to protect themselves, to ensure that as much as it's within their power, they stay clear of this disease. Because even if there is funding, you know, the quality of life that you can live when you're managing a disease is different from the quality of life that you have when there's no disease to manage. Because there will be a lot of lifestyle changes, because now your immunity is compromised, and so you need to manage your lifestyle to ensure that you don't further compromise your immunity. So as much as government will embark or needs to embark on more sensitization in schools, in religious houses, in the marketplaces, to bring about that consciousness again that HIV and AIDS is real. And as much as government needs to put in money, yes, some of them have gotten it by their bad behavior, but we do not need to throw away the baby alongside with the bathwater. We can also come in to help so that we don't encourage the spread as well. But people need to take it as personal responsibility, how you live your life and what choices that you make.
Thank you very much.
And it's also not a disease of the poor.
Well, I really hope so. And
poverty exacerbates any negative condition.
So. Yeah, because it seems that you will have more poor people actually benefiting from this than the rich, and that is why that we also need to look at the data to actually see how many people in the AB social economic group against those in the CD and E social group that actually have been affected by HIV. Because one way to also look at it to see if poverty is also cause of it, then we have to address the issue of poverty so that people can actually have a life that is more meaningful.
And the poor person should have more sense, because when you have problems, it means that you are less able to handle it.
Okay. Whilst I believe that the government has the responsibility not to only, you know, dole out funds to the Ministry of Health and Social Behavior, that's the minister, Mr. Allocates. I also believe that government should also focus on enlightenment and creating awareness from the primary, the secondary schools. When I was in secondary school, I remember receiving one of those awareness from the government agencies in regards to drugs and how youth should not, you know, delve into that aspect of life that could, you know, mar their existence completely. The National Orientation Agency also have a role to play in this, and most exactly the way and manner this money, 4.8 billion is going to be spent. Please let it be used for that purpose. No part of it should be diverted to anywhere else, so that we can achieve the purpose of which the government is here.
Can I talk about for Allocates? I saw on his Sando yesterday that even foreigners are coming to Nigeria for treatment.
Oh, but that's no news, actually.
It is a huge news.
No, it's not news.
That's
it's
kudos
no
to
news.
the health sector. It should be news.
It's not news. The reason why I said it's no news is because abroad, medical, when it comes to health and treatment, the price to pay for it is quite high. And that's why you see doctors are paid very well. And Nigerian doctors, we know the issue with Nigerian doctors who are going over there to find green pasture. And most of Nigerians or the ministers, government officials, when they travel out there to get their health fixed and checked, they see their brothers, like, well, he's a Nigerian and he's a doctor, attending to them over there.
Please, so, I'm surprised
we need
that Nigeria are doing medical tourism to India, doing medical tourism to China.
We're having a reversal. It is a reliable information I have from those who are coming from abroad down here because of how expensive it is.
When Nigerians are doing medical tourism to India, doing medical tourism to China, doing medical tourism to Saudi Arabia, doing medical tourism to England, and we are now having people from other climes coming to our own environment for medical tourism. You say it's not
news. I say it's not a news because it's something I know that's been on ground.
It is news.
It's huge news.
And we'll treat it as big news.
And
news.
All right. For Nigeria.
It's good.
Fine. If you need a place to embark on for medical tourism,
come to Nigeria.
Yeah.
And I know they are not coming here to die. They are coming here to live. It's also a testament to our health facilities and institutions. Is also getting better. That is attracting people from other climes to get treatment here. And I think we can do more. So to Allocates, thank you for what you are doing.
It started existing before Allocates.
Kudos to our medical practitioners who are living up and actually making us proud.
Yes, indeed.